Hey, welcome everybody. It's me, Dr. Khaled Sadek, and you're tuning in to another episode of my Sunday night live stream. If you've just seen today's latest pop, welcome. Thank you for joining us on the live stream. So we've just done a fantastic cyst on someone's jaw, and it was quite large actually, and it came on an army officer, very trim, very well chiseled, but he had this protruding cyst. And so getting that out was a massive relief. And we got rid of Steve. That's what the boys in the infantry called it, down the platoon down on the south coast of England. So I hope everybody's well and warm. In United Kingdom, we had a bit of snow last week, and I've been getting lots of messages from everybody around the world showing me some wonderful photos of their snowy lawns and country. And it's a virtual snowball going straight at you. Now remember, in this live chat we're going to be covering questions, we're going to be covering pops, and because this is the dedicated live stream, we're going to be treating you to some unseen footage that you won't see on the YouTube channel outside this particular show. We're going to release two pops. We're going to go over the surgery that we just did. Give me some feedback about what you thought of the video. Let me know if you've got any questions. We've done a lot of videos recently, a lot of Q&A sessions on the COVID vaccine and the coronavirus as a whole. If you've got any more questions, let me know. So with no further delay, let's just crack on. Let's go and look at some of these unseen footages that I've been telling you about. Why are they unseen? Well, because they're very, very quick, but they're very, very good. And so YouTube won't give us the impulse, the energy that we need to kind of take it to that next level. So also we've got some posts. We've got some posts here. So you all know that Marsha sent us her lovely photos up there and a lovely card of a penguin, of a flamingo. We've also got some cards from Ontario, Canada. So they'll be going up on the wall behind me. And this one is from Siji. It says, Dr. Khaled. I don't know if you can see that. Can you see that up there? You can see that. Let me read it. It says, Dr. Khaled, hope you're well. In 1967, Queen Elizabeth II donated a pair of royal swans to the existing herd in Stratford Avon River, ensuring a healthy and diverse swan population. They are beautiful creatures, still thriving today. I live in the hamlets of Shakespeare, which is very small, and there's no postcards. And this is 10 minutes from where she's based. So there we go. There you go. And that is Stratford, Ontario, not Shakespeare territory in the UK. So there we go. That's from Ontario in the in Canada. And we've got another card. And we've got some more cards coming, but I think because they're a bit delayed, they're going to take a little bit of time. So let's have a look. So this one is from Gail Sharp, our regular viewer. Thank you, Gail. A beautiful heart there. Can you see that? Where's the camera? I know it's this day. I'm just kidding you. Okay, let's have a look at this one. So, Dr. K, you'll never know how much enjoyment the premieres and live chat have brought into my life. Gail, that's beautiful. Thank you so much. I lost my husband 3.5 years ago to cancer, small cell carcinoma of the ureter. Look, rest in peace. God bless him. It's been quite lonely without him after being married for 63 years. 63 years, Gail. That's amazing. That's amazing. Thanks so much for the effort and the joy that your YouTube channel brings us each week. Your friend and subscriber from Texas, Gail Sharp. This is the Gail Sharp in memory of her loving husband, Mr. Sharp, and it's a beautiful card, and that's going to be going up on the wall. And if you want your cards on the wall, then make sure you give us, you send them in, and we'll take them on there as well. We also had some messages on Instagram. I just want to try and load them up. So Sherry Stevenson sent us some pictures from Ohio. So there is some, I don't know if you can see that, some snowy Ohio. So there we go. So no further ado, let's crack on. Let's have a look at the first of our short videos. Let's shrink my face into the corner up here and then load up a video. So let's have a look. Let's load this bit out. Okay, so it's a pilar cyst. It's right up there by the hairline. We give it a good clean and then we're going to get cracking. So this is a really common location for pilar cyst. I typically notice that if you've got a pilar cyst in that particular spot, you'll have multiple pilar cysts. I don't know why, but that kind of like at the start of the hair there. That seems to be very popular with multi-pilar cyst presentations. So put some local anesthetic. We're going to put some local anesthetic in there. Why not just get rid of my face? You don't need to see my face. Get rid of that. And there we go. So the anesthetic, honestly, is often the most painful part in cyst removal because it's got a bit of adrenaline. And what that does is basically constrict the vessels and cause a bit of pain. But it's great for reducing the blood loss, which is invariably going to happen because you cut the skin, you cut blood vessels, you do bleed. So the scalp is notoriously well perfused. We make that small incision, very, very small. Who do we have in the house? Let's have a look. We've got Alessandra Testa from Sao Paulo. Welcome. Sulalali from London. Sid G. Welcome. Thank you for the card. Zoltrane from... where are you from? Where are you from? Welcome. Kelly. I'm not new. They just switched things around. Made me miss a lot. I know, Kelly. We've been waiting for you. Oh, look, did I miss that? That just came out. Came out really good. Julie Hand, welcome. Jill Bentley, Barbara Riggins, Robin Scarborough, Angela Thornton, Anna Stern, Mary Folks, Diana Helen, Bridget Schumacher. Prince Azam is in the house. Our man behind the cam, medical mystery man. Mary Folks, sympathy with Gail Sharp. Absolutely. I think today's video and today's show is dedicated to Gail Sharp in memory of Mr. Sharp. Mary Pat, hello from Oregon, United States. Caroline Steed, how are you doing? Deborah, I actually made it on time. Yeah, you certainly did. Caroline Tom, welcome. Dr. Sarah, orthodontic surgeon, welcome. Casey, love watching, sharing, absolutely. Ciao, Mandibula, Suki M, Raki, how are you doing? So many wonderful, amazing people. It's Karen from Lancashire, love watching you, and I wish I could come and see you because I have skin condition and I don't really want to have any more treatment. Oh, bless you. Arzu, how are you doing? From Turkey, how are you doing? Hello, hello. And Runza from Italy, Gail from New York City, Kathy from Hoover, Alabama, Suki, Abonis, Jerry, so many wonderful people, So this video is coming to an end. So what we'll do is we're just going to flip the switch and just move straight into video number 2. Let's have a look. Where's it gone? This always takes a bit of time. Just bear with me. This one. This is what I want to do. So another pile of cysts. As you can see, they're really good videos, but they're very, very brief. They're literally 2 minutes. If I could string it out for a good 20 minutes like others, maybe we'd have a video, but you know, it is what it is. If it comes out in 2 minutes, it comes out in 2 minutes. So this is another one, really common. As you can see, men and women equally get these. Great pop as always. Thank you, Margaret. Laurie, how are you doing? Sid G, Anna from Holland, welcome. Caroline Tom from Wales, welcome. Julie Hands. Wow, that was really quick. Dion from New Jersey, welcome. Gilbert Seth from Botswana. Wow, send me a postcard from Botswana. Please, I want a postcard from Botswana. Here we go. Let's give it a good squeeze. Kit Kat says nice pile of cysts. Make sure you hit the like. How many likes do we have on the show? How many comments? Someone give me an update on the likes. And the next video, I'm going to go back to the chap, that Scottish chap. Let's go through that. And what I'm going to do is I'm going to comment blow by blow and take you through it. Jerry loves watching our cyst removal. Brilliant. And from Plano in Texas, welcome. Aries, welcome. Chrissy from the United Kingdom, welcome. Excellent camera work. Loving the surgery. Thanks for sharing. Yeah, absolutely, Sulalali. Thank you for tuning in. Jill, 85 likes. 85 likes. 400 people watching. Come on, guys. There's no excuse. I want to see 200 likes. Well, 200 likes. Come on, give me an update. 200 likes. This video is great. A lot of people will be wanting to watch lipomas, and maybe we'll do that. Maybe we will. they don't seem to be as popular as cysts, but we've got some real hairy lipomas. Camel Mitchell from North Charleston in South Carolina, welcome. I'm new to the channel, and ever since I found your channel, I've been binge watching all your videos. Camel Mitchell, you just keep binging, don't worry about it. Plenty more cysts to come. Dean's saying, I don't even know where Botswana is. Helen Gregory from Africa, not enough likes, everybody. Come on, everybody. This is the hardcore. 106 likes, 400 people watching. Come on, hit the likes. Come on, let's do this. Right, so before we move on to the next clip of cyst, we'll have a little intermission. Compose yourselves. I've got a little drink. There's no rush. We've got time today. And then we'll cover some more videos. All right, intermission. All right, enough of the intermissions. Let's crack on. So, hope everybody's doing well. Thanks for joining me. Oh, the camera stopped. Let's try that again. Oh, no. Oh, my camera's frozen. Okay, well, what I'll do is I'll shrink myself, if I can. Let's shrink myself. And then what we'll do is just crack on with the audio from me and then the video of the next one. I'll sort out the camera in just a moment. So, let's have a look. So this is the chap we did just now on the YouTube. What a cyst! What a real gobsmacker of a cyst, isn't it? It's just so big, and it had been there for years. This is a military gentleman, so obviously, you know, he's pretty hardcore. He's seen a lot. He's had deployments in Afghanistan and Iraq, so he knows his stuff. He was in London. He was based outside. He came in just to get the cyst done, and he was telling me how the chaps at the base gave it a name. They actually called his cyst Steve, which is brilliant. And they actually gave it a farewell party just before he came up. So that is amazing, isn't it? So get that local anesthetic in. Yeah. There you go, I'm back. I'm unfrozen. The internet tried to suppress me, but I'm unsuppressible. Also, we've got some new plants. Let me know what you think of my lovely plants. I've also got some daffodils here. Hopefully next time you join me, they'll be in blossom. They're from the garden. Okay, I admit not my garden, but they are from a garden. They're a garden centre at least. So we'll put that there. And I don't know if you can see behind me here, we've also got some lovely shrubbery. So, you know, it might look like I'm in the middle of a jungle, but I'm not. I'm in the studio. So let's while you're watching this, I'm going to talk over it. I'm going to move myself strategically down here or up here. Or wherever really, it could go anywhere because it's kind of mobile. And I'll read some of the questions. I could fly to London to help you with your technical problems if you like. That's Mary. Mary's giving me some technical. Yeah, why not? I don't know how to fix anything. Yeah, I mean, I don't. It's just temperamental. I think it's because we did a new software update on the computer, and then the codes and the drivers. It's surprisingly complicated to set up a live streaming studio. If you could see what this looks like around me, the lights, the cameras, the wires, it's really it took a long time to put it together, I have to say. So Dean is asking, I want to know why lipomas come about. Why do they form? Well, look, we've done a video on lipomas, but I think it's time we do another one. So lipomas are benign fatty growths. That is to say, they are tumors, but they're not malignant tumors in the sense that the most common cancers are. They don't change into different cells. They don't move around the body. They don't grow rapidly. They're benign in the sense that they stay fat cells and they stay in the same place. So they're benign fatty tumors. Why do they come about is the million-dollar question. Now, often we just don't know, is the honest truth. And a lot of patients come in and say, is it because I eat like strawberries, or my diet is bad, or we're not sure. But we do know is that some forms of lipomas are inherited through genetics, and there's a family tendency, especially with multiple lipomas. In conditions where you have multiple lipomas all over the body, definitely have a genetic element. From my practice, I've also identified that trauma is also a common cause of lipoma formation. I often find people presenting with lipomas on the forehead, football players for instance, or ladies with lipomas on their shoulders, or someone who's had a fall and developed a lipoma on their back. So trauma is definitely a form of lipoma initiation. There we go. Hope that's useful. What else we got here? I love to see the cherry trees when they blossom. I stop to take photos and admire them. That's Alessandra. Well, look, close to where we are in South Kensington, there's like I think around April time, April, March, all the cherry blossom comes out. So I will be sure to film that for you. If you've been watching on the Instagram and the YouTube, you'll see the horses going past the clinic very frequently. So the cherry blossoms around South Kensington are absolutely stunning, especially around the Victoria Albert Museum. So we'll show some more of that. I think we've done some of those in the past, and I think there's some on the Instagram. So if you haven't seen that, then go check that out. How many likes do we have? Sulalali, give me an update. Question. That's a good question, Angela. I have the same question. Okay, well, I'm glad we've answered that. Angela Thompson says, how can you make sure the anesthetic is working and the placement is right? That's a good question. It's experience at the end of the day. It's just, you just kind of know with surgery. It's very much operator dependent. It's not like a fixed procedure. Each one is different. Each cyst is different. Each procedure is different. Each risk is different. And it's just a matter of having the experiences to know how to proceed around that. But you've got to put a decent amount in at the very least. Sarah Lee, is it true that you have to remove the sac or it comes back? Or is that an old wives' tale or urgent legend per se? Look, absolutely. If you don't get the sac, like, that's what happens when you squeeze your own spots. They just grow back, right? So a lot of people I had this spot, I keep squeezing it, it keeps coming back because ultimately you need to remove the sac because the sac is what's growing in there. That's what's producing the stuff. So definitely you've got to remove the sac, and we try and do that in every occasion. Now, what I always say to patients is, a cyst, you can imagine it like a party balloon. So if you get a big balloon and you blow it up with air, and then you fill that balloon with foam, that's a cyst. When it gets infected, that's like taking a pin to that big balloon, popping it, the rubber disintegrates, and all the foam seeps out. And that's what you get in an infected cyst, an abscess, a boil. Okay? And so it's very difficult to get the sac out when it's fragmented like that. So in those instances, you get a much higher risk of recurrent growth in infected cysts because you have to kind of curette it and wash it. So you want to do it at this stage where it's not infected, and you can just, as I'm doing there, just separating the tissue planes with some blunt dissection with a woven swab so that we can get the sac out. So that's the aim of the game. It's not just to drain it. Anyone can drain a cyst. You can drain a cyst in your bathroom. It's getting the sac That's the next level. So you got to get the sack out. Okay. Do you like pushing out the sack? I like dissecting it bluntly. From the Czech Republic, we've got Hannah Nesvatova. How are you doing? Welcome. Gibby's wife, I like seeing the beautiful red burning bushes in autumn. Well, we've got to wait a few months of those. Cassie, can I plug my Facebook group? Where shall I share all your videos giving you credit, not stealing them, like many people do? Yeah, sure, Casey. You can just forward them, share the videos on your YouTube. Obviously, don't rip the videos off because you'll get a copyright writ against you. So, Sherry, did you find out why one horse didn't have a rider? Yeah, Sherry, well remembered. I didn't know. I guess they've got a stables, a Royal Barracks, are local over in Hyde Park where they keep the horses for the Royal Guards. And I guess they just were missing a soldier. And so one of the horses just came out for a jolly. It was quite a scene. I've never seen a horse without a rider on the streets of London. But there we go. That's just the Royal Borough of Kensington and Chelsea. What can we say? What else is there? Is it possible cysts form as a result of mental trauma or stress? That's a good question, Dean. I mean, look, stress can cause all sorts of things, from heart attacks to dodgy bowels to obesity. Why can't it cause spots and skin breakouts? Absolutely, yeah, definitely. Alessandra, I know I'm coming back to Italy as soon as I can. London is in my plans when I get there. You're welcome, Alessandra. Bridget, yes, I want to know that too. What is it? What was the Bridget question? Let me have a look. Scroll back up. Question, can lipomas calcify? Good question. Technically, they can, but often they don't. There it is. What are sacs made from? That's Helen Gregory. Sacs are made from specific types of cells, epidermoid cells in essence, which tend to grow in a bag, and they have this capacity to produce sebum. So they're specific cell types. In the same way skin is a specific cell type, or the kidney is a specific cell type, the epidermoid cells. Okay? Can you group the short videos together and share them that way? You can't edit them and dice them up like that. Luckman says, the doctor has a following over here. Welcome. To train them and vet them, getting used to the outdoors and the traffic. That's from Christiana Maria Drutas about the horses, how to train them. And while we're doing that, the sack is out. There it is. Wow. Look at that. Wow. What a fun day. Usually they get horses without a rider. Ah, I see. Okay. Help the doctor out and hit the like button. Kelly, thank you. Absolutely. Wow. I love these evening sessions with you guys. It's so much fun. How many likes do we have before we finish the show? How many likes? It's very colourful. I like this colour scheme today. Get your postcards in, because I want to put them on my wall, especially everyone from around the world. Send them in. Get that stitch in there. Doreen Carpenter, awesome. I've been enjoying your pages and sites. Thank you for sharing your knowledge. Texas girl in VA. Is it better if the patient shaves before the procedure? Yeah, I mean, potentially, but it doesn't make a huge difference. You just got to focus on the job at hand. How long does it take to train to become a skin doctor? I mean, my career path is anything but orthodox, and it took a very, very long time. So Caroline Tom says, my grandmother used rosemary and hot water cooled for cuts on the leg. Interesting. 192 likes or 146 likes? Doctor, how can we send you stuff? Well, look, if you want to send anything, just send it to the Smart Clinic in South Kensington, 30 Thurlow Place. Wow, what a colourful display. I like the colours, and I just want to thank everybody for sorting this out for me. You know who you are. Thank you. Well, look, I'm going to wrap up today. Thank you all so much for tuning into the Sunday Night Live Chat, for enjoying the premiere. Remember, we're going to be releasing some more videos and more live chats on Wednesdays, Fridays, and Sundays at 8:30 Greenwich Mean Time. Make sure to find me on Facebook, Twitter, and Instagram. Stay safe. Get your vaccines. Wash your hands. Keep your distance. And I look forward to hearing from you all very soon. In the meantime, take care. It's goodbye from me, everybody. Take care. Bye-bye.